Hello, Namaste everyone. I welcome you all to the session 48 of Gurubodha with our Ayurveda teacher and Ayurveda Guru Dr. M.B. Gurada sir. I dedicate this and all of my works at the holy feet of Dr. A. Chandrasekhar Udupa. Moving on to the Ayurvedic topics now. Now that with the globalization happening, it has become very easy for us to get exotic vegetables in Indian supermarkets. Broccoli, quinoa, soybean, strawberry, different types of berries are easily available for us. So, is it healthy to try them at least, may not be on a daily basis, at least once in a while, or they should be considered as not to be tried at all? So,
Those who are born in this continent or these places, what and all available here that can be used in a daily basis. But something which is from the other part of the globe, when we are trying to use it, be cautious and once in a while you use it, but don't make it a regular habit because your system or your body may not be accustomed to that. That is one part of it. But still, all those things which are in the form of vegetables and all those things that can be used to certain extent, but all those which are virya pradhana falls under the category of dravya or aushadha that needs to be taken care of and it should not be consumed on a daily basis. But once in a while, you can go for the other things which are somewhere in the global part of it, anywhere it is growing, that is good. It is something like that. When you are in Rome, be like a Roman. That is a basic idea that when you are in India, be like an Indian. When you are in America, be like an American. But only thing is fine corrections, whatever it is required, because you are not born and brought up in America or England. You are somewhere earlier in India, then you are shifted to America. Now your lifestyle and atmospheric conditions is changed, but you need to tune up accordingly. So by adding certain things from the Indian continent and adding certain things from the Western continent, all these things to be taken care of with a balancing effect.
yes, sir. Especially, I mean, when somebody goes out of India, that balance needs to be taken care, and they should not live out entirely the native Indian diet and entirely switch to that.
Yes, definitely such type of combinations need to be done because our body is accustomed to that since so many years we are following it and suddenly we shift to some other pattern and definitely they have got in their own influence. So we need to understand that whenever we are shifting or slowing also, then that is like how we used to do regarding the Ritucharya or anything like that, in that how Sandhikala Kriya Kalpas are there, or Sandhikala, how the Kriyas should be followed. Amshamsha Kalpana, you have to leave say, little bit and practice the next Ritu's Charya. That needs to be followed here also. When you go suddenly to some other continent where entirely typically the different type of food style is there, so it is better to adopt those food styles slowly by adopting or leaving the earlier food styles partially. So we need to balance it.
Continuing with the last week's topic, which herbs can be taken or which food ingredients can be taken on a daily basis and which cannot be. One thing is that rasayana or anti-aging herbs or food ingredients. Just because something is explained under the chapter of rasayana means it has a cell rejuvenation effect and so on and so forth, anti-aging effect. But that does not necessarily mean that that can be taken on a long-term basis, right, sir? Because we have Chitraka, Bhalataka, etc., which are rasayana, but to be taken care.
Definitely. See, not every drug can be taken for a long run. There are certain drugs which falls under the category of Aushadha as well as on the category of Ahara, somewhere between that. That's what the present day nutraceutical area is. Any drug which falls under that category, they can be safely used for a longer duration, like ghee, like Shatavari, Estimadu, something like that, which is not going to disturb the doshas to a large extent. But swasthayata dravyas, that needs to be taken in a long run, nothing to worry. But all those which are potent, strong enough in their virya, but they still behave as a Tridosha or they still behave as Rasayana, that needs to be taken till what the rasayana effects are achieved. Till that, we need to go with a strict dosage pattern. Later on, it is better to reduce the dosage so that temporarily therapeutic or maintenance dose can be managed with those things. And if sometimes if it is still, it may cause certain untoward incidents in a long run, it is better to skip or stop them for a while temporarily. Then once again you can restart in the corresponding times. For example, if you are taking Chitraka in any way or Balataka anyway, it is better to avoid them during summer as well as in Sharad Rutu. Those two times already the drug itself is Ushna and season is also favoring, then it may cause into trouble. So that time it is better to slowly avoid it and you can stop it there. And then once again, once it is a colder season, you can start using it.
Another thing is that many of the herbs are explained as Tridosha Hara, or which balance out Tridosha. Even if some herbs are balancing Tridosha or Tridosha Hara, it doesn't mean that we can take on a daily basis, right, sir?
So definitely, once again, it comes in the same category. Whether this dravya, which is we are considering for a time being XYZ, this dravya is a ahara dravya or an aushadha dravya. That is a big question there. If it is a aushadha dravya, then it is a virya pradhana dravya, and all those virya pradhana dravyas are comparatively potent enough to bring in the changes in the doshas, where compared to the ahara dravyas. Ahara dravyas are quite safe because they don't disturb the doshas in such a way that how a medicinal or the aushadha dravya behaves in the body. So if it is falls under the category of ahara dravya, we can use it for quite a long time, maybe 6 months, something like that. But if it is ahara dravya, I mean it is aushadha dravya, then it is better to use it very specifically under the guidance of the doctor, that how long you can take it, because he will be observing you for the changes in your body, and sufficiently if some changes are occurred, then it is better to stop them for a time being. So that type of rotation, on and off method of doing or using them, that should be followed.
And another point is that, especially in the Western Ayurvedic tradition, I have seen, if it is Tridoshic or Tridosha balancing, we should be using it, even the food ingredients or spices also. Only if they are Tridosha balancing, we should be using it, otherwise not. That kind of a wrong notion is there. So the ultimate goal is that the food should have all the 6 tastes, and in that individual ingredient may be balancing, one may be balancing pitta or vata or kapha, etc. For example, salt. Salt naturally increases pitta but decreases vata and kapha. And a lot of spices, including black pepper and all, they are not Tridosha balancing, but still we use. So the whole composition of the food matters rather than the Tridosha balancing effect of individual ingredients, sir.
It's a multifactorial. We need to understand it is not simply one food only, it's causing an influence over the doshas. We have a genetic predisposition. We are being brought from the mother and father's chromosomes and all those things, what we in present modern day speaks about. It is in the form of bija, we call it as in Ayurveda. The Matrija Bhava and Pitrija Bhava, those things which has come and that ultimately resulted in the formation of a human body. And we are all landed in this earth or universe with some sort of composition inside in our body based on our Prakriti has been decided. So we have a predisposed or somewhat pre-designed doshic structure inside the body. Then accordingly, every time seasons influence on the body will also be there. That's why the Dinacharya has been said. And even in 24 hours of a day, there will be influences on our doshas. So not always we will have something like a mathematical understanding like 33% of vata, 33% of pitta, 33% of kapha in the body, and it is making the 100%. No, that type of thing will not be there. It is always a fluid situation. Something will go a little bit more and something will reduce. That's the reason the acharyas have very clearly said vata will increase in particular season, pitta will increase in particular season, and kapha will increase in particular season. That's the reason they have quoted all these ideas. So we need to understand these concepts first. Then comes the introduction or using of very clearly Tridosha Dravyas. Typically, if a person having influence of the body is somewhere between 33%, 33%, 33% for the sake of understanding. If we consider as a human being, then he takes it. Then there is no role of this Tridosha Shamaka Dravya to act upon, because there is no increase of doshas. If it is increased beyond a certain limit, then only the drugs will have the role to play. So similarly, when a combination of such type of combination variations, permutations are there, if Tridosha Shamaka Dravyas are given, they are having the potential to bring the doshas to the normalcy. That is the only way, that's the reason that we can use them as a combination or a single drug which has potential to bring those the doshas to calm. Otherwise, if we use one drug, if it is potent to Vatahara, then time being the person we are trying to Vatahara, we are doing it, by the time it also increases the Pitta. That is a problem. But when we give Tridosha Dravyas, while addressing the Vata, the drug is even capable of addressing the Pitta if it is increased by any course of treatment or by natural ways or by influence of the 24 hours of cycle or influenced by the Rutus polarities. So if you are using a Tridosha Dravya, it is having the capability or the forces are ready already in the body to curb the things which are made of erupt as a challenging task at the time of treatment or when the course of duration of the treatment is going on. So that is the only benefit out of using a Tridosha Dravya. Otherwise, we can select pinpointedly, we can use a particular Doshanashaka Dravyas accordingly. But still, there are occasions where we have using Vyadi Viparita Arthakari Dravyas are also. The Dravyas which are directly acting on Vyadi and reducing the Vyadi, not only on the doshas. So there are multiple factors of these type of things that needs to be understood while handling a condition.
Thank you, there, sir. And there's a question: what about Amla? It is considered Tridosha balancing. Can this be taken or not? So we covered this Amla ki in the last class. Let me share that quickly. So this is from Ashtangradhyam Sutrasthana 8th chapter, foods that can be consumed on a daily basis, in which Acharya Vagbhata explains rice with barley, rice which matures in 60 days, that is Shastika Shali, all those things. And in that, Amla or Amlaki is there as one of the ingredient. Considering not only the vitamin C factor, also the boosting immunity and over and above main ingredient of Chawanprash and also there in Brahma Rasayana, etc. One safe thing that we can do to ensure our immunity is good is probably include Amlaki at least in the form of pickle or something in our diet on a daily basis, sir.
See, that's we need to understand things in a pattern. It should be understood. For example, our immunity. Our immunity is not something which is just by giving some medicines or some food particles or something like that, which we can alter or change it or influence on that. It's had its own limitation. Our immunity is one is from the Pitrija and Matraja Baba, so it's an inbuilt character. Then our age, our Agni, the food pattern, what we are using, all these influence on the immunity. So we can only take care of certain things like by secondary supporting factors which can help in bringing down the, improving the immunity. For that purpose, we can use certain drugs. They are capable of improving our or supporting our immune system. So in that Guduchi, Amlaki and all these comes under. So it's only a one part of when which is supporting the immunity. That needs to be understood. Second thing, Amalaki is one of the important fruit which can be used regularly, provided it also has some limitations. But it is a Tridosha Amaka, no doubt, but still, even on a long run, even that may also cause little bit of increased pitta. So, but we need to understand, it doesn't mean that it will definitely going to increase pitta. It may be in a person who is already having a strong pitta prakriti, pitta supporting the thing in his constitution. This one in a long run may cause certain issues. So we need to understand that.
There is a theory that certain ingredients, like medicinal herbs or aushadha or food ingredients, which are told as vishahara or anti-toxic. So these, I understand that they may not be used on a daily basis, but at least considering that food is so not in its purest form as it used to be earlier, and one of the other chemicals are used in it. So probably, is it a good idea to have something like a shirisha or vilvadi gulika or turmeric, etc., as a natural detoxifier, to put it in modern terms? May not be on a daily basis, at least say once in 2 months or so. So
See, something as a natural detoxifier, Shirisha, Vishaharagna, that type of thing may not be a good idea to continuously use it. But our ancestors were also knowing it, and our acharyas were also knowing that. That's why in most of the Indian food preparation, Haridra is used, very clearly suggesting that Haridra is a natural detoxifier. So that's the reason we use Haridra in all rasams, curries and preparations when we do it. So that's the reason the natural detoxifiers can be used in a long term, and it is good also. But we cannot use a Shirisha in such a sense of how we use Haridra. So there is a difference in that.
thank you there, sir. And someone has asked, like, when you say long run, how long is considered as safe in case of Amla?
It may be till you get some untoward incidents. So it is better to consume under the observation of a doctor or a Vaidya. Continuously use it for 6 months, year, no issues. But patient, when he starts complaining of some other issues are being developed, like mouth ulcers have been happening, or getting skins are getting peeled off, all these things will occur some people. So in that time, it is time to withdraw it for a time being. Then once again you can reintroduce it. So that's the way you need to go for on and off treatment protocol.
Amlaki, I know that it has been explained as Sara, but in some cases I've seen people complaining of two main things. One is that dryness of the skin, continuous use for many days, and second one is, in some people it causes constipation, like many have complained. What could be the reason, sir?
No, usually with Triphala, we may get constipation as a complaint, but there is a rare chance that while continuously using Triphala, slightly increases Rukshata in the body, and that Rukshata induced in the body because of this reason may influence Apana Vata and act as a material causing for constipation. Otherwise, I don't think so. By Triphala in any way acting as an rebound constipation is been, once you take it the initial stages it is working for the constipation, and once after some time it reverses it. It's very rarely happens in very rare constitutions, not in always.
Previously, when we had asked about, list few ingredients which you think can be used or cannot be used, you want to inquire. How about this sari or sarsaparilla, sir? Sarsaparilla juice is available. Hemidesmus indicus, very good rakta doshahara, blood detoxifier, useful as juice. Maybe not on a daily basis, at least on the pitta aggravated seasons like autumn and summer can be used.
See, definitely for everybody, Sariva is good during summer as well as autumn season. And the other one, those who are suffering from skin conditions are Rakta Vikaras in for them, and those who are suffering from acidity are Pitta Vikaras. Without the Pitta, what are the conditions they are facing it in all those times, and even for the Madhyama Vayaska, where there is a dominance of Pitta is there. During those times, Sariva is good. Sariva can be taken in the form of juice, can be Sariva Panaka, it may be Sarsaparilla can be used. But only thing is, these are the people who are very clearly those who work in a very hot atmosphere, those who work in particularly in an industry where furnaces are there, they need to stand in front of the hot oven or something like that. Those types are otherwise in those places where temperature is particularly in those season of summer and autumn comparatively higher end, and those who are having natural tendency to have increased pitta by their nature. So in all those people, Sariva is one of the definitely one of the good one.
So much for detailed answer there, sir. What about nutmeg, sir? It's used in some of the dishes, but in very less quantity, and overdose may cause a little bit of complications, sir.
Nutmeg is very good for assimilation, but that should be in a particular small quantity in the food. If more dose of nutmeg is consumed, then it leads to stambhana or malarodaka, and a constipation effect will be seen.
Probably it will also affect how the brain functions if it is taken excessively, sir.
No, it is definitely, it has a stambhana effect. That effect can be traced back to wherever the scope is there for the drug to act. Definitely in all those areas it is going to cause a stambhana effect, because it's a potent kashaya rasa dravya. Initially this kashaya rasa to some extent helps in absorption, but later that same kashaya rasa will make it constipated, stambhana karma. It stops the things to happen. It reduces the secretions. So thereby it also, because certain part of the body needs some certain secretions to maintain the normalcy. Even those secretions will be stopped if it is overdosed.
Thank you, sir. And last two ingredients that have been frequently asked, one is gotu kola or manduka parni, which explained as Tridosha we usually make in this part of southern part of India, especially in Karnataka. We make a tambuli out of it. Some people make it as a chutney and consume it. I usually given even to the children to improve brain functions and all. Pretty safe to use, sir, gotu kola?
Definitely, it will be safe to use because it is indicated in child age group as well as the learners, those who are in education part of it and they are completing their education. So it will be good for them, particularly the brain functions, as well as it is also good for the skin condition, and it is one of the important immunomodulator. So it can also be taken for a long run. It won't cause you any untoward incidents. Once again, it can be taken on a day-to-day basis also. You can take it, or even 3 times in a week or something like that. So there will be no issues of that kind. So gotu kola can be used. It is supporting the blood as well as the skin and brain.
Thank you, sir. And last one is like guduchi. Probably one of the most used herb in the 2020s with the COVID times. It came to the fore and there was like a controversy with CRISPR and terms for the cauliflower. We discussed that in great detail. May not be on a daily basis, but very important herb of Ayurveda and used widely, sir.
That's why it's called as Bishak Priya. That's the reason it is sufficiently and as a prominently used by acharyas. All the vargas many a times are said as a Guruchari Varga, something like that. So all these things indicates that sufficiently gives information that this Guduchi is one of the important drug which is supporting to the body, and it is Tridosha Hara also. So it's definitely one of the important drug for the particularly in Ayurvedic doctors.
Thank you, sir. And in cases where children often suffer from the respiratory issues like cold and chest congestion, asthma, what needs to be the appropriate method of treatment in care to be taken in selection of Ayurvedic formulations? Brief considerations that you think when you think about respiratory issues, how you pick herbs and medicines, sir, please.
First of all, we need to understand whether that cold or chest congestion or asthma type of respiratory issues are there, whether it is having any sankramana, bacterial infection or respiratory infection, or it is seasonal. That we need to bifurcate. Then it is only upper respiratory, urdhvaga, it's only in the nose and headache or something like that, or whether even breathing also involved, or entries lower respiratory tract is also involved. That we need to understand. When there is, particularly in case of children, when they approach the doctor, usually on the second day, third day itself, by the time there will be still running nose or rhinitis, such conditions, and headache or something like that, or irritability, fever, and there will be something like nasal congestion, something. Still the lakshanas or the symptoms are confined to upper respiratory tract issues are there. And this is a time where we need to use stambhana dravyas to stop the secretions from the nose, because all these secretions from the nose, they are highly contagious. Once they reach out into the lower part of things, then the infection or maybe allergic factors, it will be dragged down to the lower part of the respiratory system. So we need to understand that. So once we examine the patient or a child in that there is no asthmatic attack, only there is a cold, running nose and sneezing and feverish type of things, that needs to be used with Mahasudarshana Kada, Arvindasava, something like that, or we can use it Guduchi directly in those conditions if it is possible. Guduchi with Churna with honey, something like that, you can use it. Still, if you want, you can use it in a mild dose of Tribhuna Kirti. Anything other than this, if required, is we can use Dikatu, Churna, Shunti, these type of things, or even the Parnayavani, these type of drugs which can be Tulasi, can be used in these conditions. So it will definitely give relief and reduces the nasal congestion and secretions. If that is achieved, then the infection or the cold will not go down to the lower respiratory tract. Otherwise, if it is reaches to the lower respiratory tract, then there will be very clear wheezing, breathing difficulty, and lot of sputum will be there. In that condition, we need to give a vasodilatator as well as a bronchodilatator type of drugs. And in that type of situation, our drug of choice will be Vasa, Datura, and Pushkaramula. So whatever we are giving here, along with that, these combination containing drugs can be used. You may have some powder of these things, or you may have kashayas prepared out of it, or you may have even asavaristas prepared out of it. It can be given in a smaller doses, even in case of a children. So this can be done initially. And whenever there is a lot of irritation and sputum is there, Khadirati is also one of the important in yoga, which can be used as lozenges for the in the buccal cavity, and as well as you can have even Karpuradi Churna, Tarisadi Churna, Sitopala Churna, Yestimudu Churna, that type of churnas are also there that can be used with honey. So these are the various permutation and combination. Only thing is we need to bifurcate the things for the upper respiratory tract where lower respiratory tract is not involved, and when lower respiratory tract is also involved, then we need to change the drugs in those conditions.
Thank you there, sir. Regarding Kanakasava, quite frequently used in asthma as bronchodilator, etc. Especially to use in children, do you have any age limit below which you would be very cautious?
See, as such, all the asavaristas should be given over the age of 6 years and above. Only one which is allowed in Shastra is Arvindasava. But in practice, we know that there are many such type of things which are used even in case of children, and if you use it, that will also give result. It is something like, for example, there are certain allopathic chemical drugs which are, as per the text, should not be used in case of a children. But in the market, we get all pediatric suspension and syrups of that ingredient. Even though text says it should not be, but it is available because it gives a result temporarily or permanently, then that's the reason they are used. Similarly, on those lines, these drugs should be given above the age of 6, but we can use it below the age of 6 also, but we need to have a caution over the doses. What dose usually we give to an adult or a child, even lesser than that dose can be utilized for the toddlers. So it is not a big thing that we cannot use it, or it is not a total taboo on that. It is not like that. It can be used.
Thank you again for clarifying such a big doubt, sir. Question is like I have a 68-year-old female client recovered from chikungunya, but now experiencing severe joint pains all over the body. What can be given to her? She's not having any previous history of arthritis. Post chikungunya arthritis is very common. Because of the history of Jwara, can we consider it as AMA induced? And in terms of medicine or herb choice, how to approach this, sir, please?
Whenever a patient complains of these sort of things, we need to understand that first rule out the patient is having diabetes or not. That is point number one. You can easily rule out whether the patient is having diabetes or not. First thing. Second thing, from the history, it is known that the patient never ever had any type of arthritis or joint related disorders. This is the first time only after the chikungunya. So when she has recovered from chikungunya, but there is a sequel, there is a continued pain in the joints. For this is due to the attack of that virus onto the joints. So in this condition, we have observed Ashwagandha Grita or Ashwagandha Grita gives wonderful result. If you ask the, of course, you have some any issues with the triglycerides and cholesterol and all those things, you need to keep it aside. Nothing will happen. But still, if you have any issues, then you need to take only Ashwagandha Churna in Dugdha, boil it and drink it. Otherwise, the best choice would be Ashwagandha Grita, because Ashwagandha Grita contains 3 ingredients: Kshira, Ashwagandha Churna and Grita in that while preparing. So that is the best medicine for the post-chikungunya pains.
Good tea also is useful, especially because considering the patient is old and has Rasayana effect and also Amahara and whatever the remnant virus, and it has antiviral effect also. Sir?
See, the antiviral effect is not required in the post or the sequel time, because already the virus has affected and it has reduced its effect, and it is the remnant of what it has been done, and it's just like the twister has come and everything has destroyed and the twister is gone. Now there is the entire thing of destruction followed by. So that destruction is causing the problem here. Such destruction needs to be addressed by such a thing which has the capability of rebuilding the tissues. And Ashwagandha Grita is one of the important ones which is rebuilding the tissue. And definitely for the post-chikungunya, that is the one best combination.
Thank you, that sir. And next question is regarding oats. Is oat considered foreign to our culture, or does it have a historic use of Ayurveda? If so, what are the benefits, where it can be used or where it can be avoided? Sir, please.
So very clear, oats is not from the India. Oats is basically from Australia. So we are not accustomed to eat those things in a sense. But we too have in Indian culture that we use plenty of Trinidanias like Navanna, foxtail millet, their pearl tail millet, the pearl millet, some ragi millet, and something like that. These are all called as the Trinidanias, are nowadays very popularly known as the Siridhanyas. These Trinidanias and the Siridhanyas, something like that, they are all ruksha in nature. That's why Ayurveda Acharyas very clearly suggested it is a Trinidhanya. Trina means the energy produced out of it is comparatively less. Trinakya samana, that's what in Kannada what we call it as. It's very much less in quantity. That's the reason those who are obese, those who are suffering from diabetes and this type of things, the people will go for this type of things, even though you can eat well, but the energy produced out of that will be, or whatever your body is getting it, will be comparatively lesser than what you otherwise the goduma or shali when you eat it. So that's the reason it is being said. And this oats, but the Australian origin, usually it's also equivalent to the Trinidanias of Indian continent, Indian conditions. So something like that they have propagated regarding the oats, which is equivalent to these Trinidanias. They are ruksha in nature. They produce a less quantity of energy when consumed, but they are bulk in nature, so they will feel a feeling effect on the stomach will be good. So that's the and but they have got a lot of rich fibers, so their digestion process delays. So all these things are kept in mind. So it is equivalent to Trinidanias. So similar to Trinidania, how we use it, oats can also be used.
Thank you for another beautiful explanation, sir. And the next question, it is on dry tuna versus a whole fruit. I mean, the question was asked in the context of Amlaki when it was explained. Due to lack of access, we are forced to use dry tunas of herbs like Amla and Anantamula, the Sariva. How is that modifying medicinal actions compared to the fresh versions?
See, it's very clear in Ayurveda also it is said, as far as possible, try to use fresh herbs. But they are also given certain exceptions like haritaki will be more good to the body when it is dried. Similarly, draksha, it will be more good to the body when it is dried, later stages. It is not the fresh one. There are certain issues that, for example, mulaka, that is also said that is the dry one is good to the body, something like that. So there are many drugs which are good to the body. They have a beneficial effect when they are dry. But when we don't get a chance of using a fresh herb, it is always suggested in the classics text that you can go for the use of churnas. Whereas particularly in case of Anantamula and Amalaki, on many occasions we also use churnas only. So there is no harm in that it will be or it is not inferior to the fresh herbs. It can be used.
And the next question. Nowadays, essential oils are becoming so popular. It seems they originated from Arabic culture. Ayurveda directly steeps the herbal essences in thylam, gratams, or water. What is your views on essential oil use as a support to Ayurvedic therapies? Example, using eucalyptus oil, pine oil, menthol, thymol, etc. So during steam therapy, so on.
Definitely, these essential oils can be used, no issues. Maybe of Arabian culture, but long back India and Arabia has a trade communications and even the exchange of knowledge. Many Arabian travelers came to India. They learned this and they also propagated so many things from the Arabian land to this land. But certain essential oils like eucalyptus oil. This eucalyptus oil is not from Arabia. There are maybe from any other part. Like eucalyptus oil is very common in Australia. But once there is a medicinal property in these things, or pine oil, whatever it is, that can be used, no issues, for particularly steam therapies or inhalation therapies. And even sometimes they are very good for the painkiller because many times the painkiller oil do contain some turpentine oil or even gandhapur oil and even particularly the eucalyptus oil and everything will be mixed in that formation of an element has been developed. So it is not a wrong thing that you cannot use it. It can be used and it has got a beneficial effect and it can be used. There is no harm in using essential oils.
What can be done to improve musculoskeletal for women over 45? Just for the general care of muscles and the bones in women after 45. Any quick tips, please, sir?
Very simple. You need to walk regularly or work. Physical training is must. That will improve the muscle activity. And once muscle activity is there, definitely it retains the bone minerals. So bone will not get decayed or even osteoporotic changes will not occur. And you need to reduce your body bulk. Those are the things and we have a control on eating. All those parameters, they are interlinked to one another. If you do all these things, definitely you will support it. And being a naturally women, there is some influence of hormones which are also supporting like vitamin D and some other hormones, estrogen and also will have an influence on bone minerals. Particularly if you are having sufficient intake of calcium and vitamin D and something like that or going in sun for a walk and all those things, if you are maintaining sufficiently, that is enough to maintain the musculoskeletal strength in women after 40.
Next question is quite interesting. Can Brahmi be taken along with antidepressants? I would also include Ashwagandha there to the question. So Brahmi and Ashwagandha with antidepressant prescription medicines. Your take on that?
Very clear. Prescription medicine, if you have taken, no issues. You along with that means the same person. Doesn't mean that it should not be physically mixed together, both the different type of the medicines. I don't suggest that. But only thing is that you need to give a clear-cut separation time between these two. Maybe 40 minutes, 30 minutes to 45 minutes or something like that. That type of time, if it is separation is given, then in that patient, definitely we can consume both the prescribed medicines of modern medicine. Along with that, we can go ahead with the usage of ashwagandha and Brahmi. There is no hard and fast rules that will going to spoil the things. No, it will not support in such manner and it won't cause anything. Only thing is that don't physically mix these two things at one place and you consume it. Like the antidepressant drugs from the modern along with some ashwagandha tablet, everything taken together. That type of things, as far as possible, avoid it because we don't know how physical contact of these two things will behave or have an effect on body. because no such studies have been done. So it is very difficult to say whether something wrong happens or it doesn't have any untoward effects. But it is very difficult. But in order to play safe and avoid any problems, it is better to give a sufficient time gap between these two medicines.
Karnaji, please go ahead if you have any question.
Yes, doctors. Namaste. Doctor, regarding that essential oils question, so basically what I was saying was this art of distillation, distilling the essential oil, that has got Islamic roots. Of course, eucalyptus, as you said, it's like from Australia, but the art of distilling essential oils comes from Arabic culture, like especially this rose. That is what they focused on. From your answer, it seems like even in our culture, in Indian culture, we also have some history of distilling herbs. Is that true?
Definitely. You have not gone through the textbook of Arka Purana and Arka Kalpana by Ravana, and very long back we have got many Arkas, Ajamoda Arka, and so many Arka Prakasha, and so many such type of things are there in that textbooks. Lot of distillation process has been told. In Rashastra also we have got different type of distillations. There are specific yantras been there, Vidyadhara yantra, Bhudhara yantra. There are so many designs have been given in Rashastra. Arka Kalpana itself is nothing but distillation process that has been explained very long back.
And especially this Urdhapatana, Adhapatana, etc. explained for the mercurial process. What can be given to wean off Adderall? Adderall is a medication that is given to improve attention span, meaning to keep oneself awake. Adderall is a synthetic drug that stimulates the sympathetic and central nervous system, used to treat attention deficit disorder and narcolepsy. It's a mixture of amphetamine derivatives.
See, definitely if you want to keep up your attention, helps in learning process and such other things, the drug of choice in Ayurveda is Jyotishmati. Celestial Paniculators, Jyotishmati is the drug of choice, which is it's available in the form of oil, which can be taken in the form of mixing with warm milk and consumed few drops. So that can be done. And even one company combination also it's available in the market, which containing Gogrita and Jyotishmati Taila and other Brahmi and all these things are there in that. Particularly by the name, I think Alert. There is a capsule from Vasu company. So such type of things are there which can be used.
The weaning of modern antipsychotic or drugs will take up in one other. What are the precautions that and all will take up in one of the other classes?